Thank you so much for joining us for this Thursday COVID-19 press briefing. Today, Orange County Mayor Jerry O. Demings will give us a status update of where we are, the numbers as it relates to the virus, and news that hits us close to home. He will, of course, share testing, vaccine locations, positivity rates, and sadly, deaths that have taken place in the county since our last press event. The mayor will also have details on rental assistance, information on county sports leagues, and more details as well. Dr. Raul Pino is here from the Florida Department of Health in Orange County, and will report important COVID-19 trending data here in Orange County. We begin with Mayor Demings. Mayor?
All right, good afternoon to all of you. Thank you for joining us here today for the 148th press briefing that we have done regarding the novel coronavirus. Just as a reminder, we live in Florida, and it is hurricane season, so I couldn't start today without at least talking a little bit about the tropical depression Fred that is expected to impact us sometime here within the next few days. I just want to let you know that we are monitoring the situation. We do expect significant rain and winds, but our emergency operations center is activated at level 2, and we'll continue to see in the coming hours what happens, and if needed, we'll come back and share additional information with you. So now let's transition. Let me focus a little bit on the deadly COVID-19 Delta variant, which continues to spread in our community. Dr. Pino has joined us once again, and he will share additional information with you about hospitalizations and the toll that we see on humans. The Department of Health in Orange County tells me that 17 Orange County residents have died since our last news conference on Monday. One of them is an Orange County correctional officer who worked at our jail here. I had the opportunity to speak with his wife earlier today, and it is with utmost sadness and deep regret that this happened for a second time to the men and women who serve at the Orange County Jail. Our hearts go out to the correctional officers, loved ones, as they cope with this tragedy. Each day this week, I was notified about someone that I know who died of COVID each day this week. And so several times as we have been fighting against COVID here within this community, I've asked you, the media, and those who join us in the audience at this press event. In the beginning, I would ask you how many of you know someone who's tested positive. Almost no hands went up. I would then ask you, did you know anyone who died as a result of COVID? Almost no hands went up. But here we are at this point in time. So I'm going to ask you again, how many of you today in this audience know someone that tested positive for COVID-19? Okay. Now every hand goes up. Now, how many of you know someone who died as a result of COVID-19? Raise your hands. So here we are, almost all of you today have raised your hands. And sadly, probably within the next few weeks, there'll be additional people who will raise their hands in both instances. And that's what we're trying to fight against in this community. That is precisely why we are doing what we're doing here. We're working hard to get the vaccine into the arms of our residents. Since we opened our vaccination-only site at Camping World Stadium, 310 individuals have received shots, 153 on Tuesday, 157 on Wednesday, and I don't have the numbers yet for today. but we want to make sure that our residents understand there will be no testing at Camping World. Only the administration of shots will happen at Camping World. As for our 3 testing sites, the response for getting COVID-19 and antigen and PCR tests still remains very strong. Our Orange County Health Services personnel have been working extremely hard to accommodate everyone. At the newest testing site, the former Claricona Elementary School, nearly 1,400 tests were administered on Tuesday and Wednesday of this week. At the Econ Soccer Complex, during the same 2-day period of time, 2,349 tests were performed. And then finally, at our Barnett Park location, those same 2 days, Tuesday and Wednesday, 2,825 tests were given out. That's a combined total of over 6,100 tests within just those 2 days. Now, if you think about that, that's an extraordinary number of people in our community who were driven to be tested because of something that they were feeling with their own human experience. All 3 testing sites, plus Camping World Stadium's vaccination site, operate 7 days a week between the hours of 9 a.m. and 5 p.m. We expect that they will remain open at least through the end of this month. We'll be evaluating this as we move forward. Just as a reminder, at these sites, there are no walk-ups allowed. The maximum number in vehicles should be no more than 4 individuals. And where are we? In terms of the total numbers, there are now 183,330 reported known cases of the coronavirus within Orange County, just Orange County. Nearly 10,000 new cases within the last week. The Department of Health in Orange County is keeping the data, and I'm not going to get into the specific numbers, but what I will tell you is when I hear 1,442 people have died of the coronavirus within our community, that should be significant to you. So we're continuing to try to move the needle to get more people vaccinated. So the I Got My Shot mobile vaccination trailer will continue to visit neighborhoods and businesses through Friday, tomorrow. The trailer will be at the Orlando Police Department tomorrow between the hours of 9 a.m. and 11:30 a.m. Then it will move to the Florida A&M College of Law between 4 p.m. and 7 p.m. The mobile trailer will not be operational on Saturday and Sunday because of the anticipated weather phenomena. The mobile vaccination trailer will now administer the Pfizer COVID-19 vaccine only and will no longer provide the 1-dose Johnson & Johnson. For future mobile vaccination schedules, residents can visit our website at ocfl.net/IGotMyShot. And now let me just talk about some other developments. Due to the spike in the COVID cases and the fact that our residents ages 11 and under are not eligible for a vaccine, all county-run youth sports leagues, including games and practices, are suspended until further notice. We know that this has disappointed nearly 1,100 boys and girls who take part in the sports leagues, but we cannot take a chance with their welfare. Just a reminder, all of our parks are still open, but the recreation centers are operating on limited capacities. We hope to resume the youth leagues in the future. For more information, you can go to our ocfl.net/parks webpage for more information. In partnership with the Orange County Public Library System, Orange County's Emergency Rental Assistance Program will host in-person office hours between 10 a.m. and 1 p.m. at select branches across the county for the remainder of August. Staff will be available during these hours to answer questions and to assist applicants applying for the rental assistance program. The program will be at the South Trail branch on Tuesdays, South Creek branch on Wednesdays, Fairview Shores branch on Thursday, and the Chickasaw branch on Fridays. It is important to note that applicants will need to complete their own applications using the computers that we will make available at the library centers. The staff cannot fill out the application for you for a number of reasons. And with that, I'm going to turn it over to Dr. Pino, and then we'll open it up for questions after that.
Good afternoon, everyone. Thank you, Mayor. As the Mayor said to you, the total number of cases is 183,330, and our 14-day positivity rolling average positivity rate is 20.07. The number of deaths is up to 1,442, and the recent added deaths, 17, are from 39 to 92 years old, with a median age of 71. 7 were female, 10 were male, 6 black, 9 white, 2 of the race, 2 Hispanics, 15 non-Hispanic, 16 had underlying conditions, and 1 had an unknown so far underlying conditions. 2 of the deaths are from July, but 15 are from the month of August. That brings the total of July deaths to 55, and August so far 18. And 3 of the deaths, of the 17 deaths, were reported in assisted living facilities. So that's something to watch. We have seen a few cases lately. Of the 17, 7 were fully vaccinated for COVID-19. With regard to vaccinations, I want to encourage breastfeeding and pregnant women to get vaccinated. There has been a recent release by the CDC encouraging pregnant women. Remember that initially the message was that, talk to your provider, make that decision with your provider. Now there is sufficient data on pregnant women and vaccinations, and all pregnant women expecting breastfeeding or planning to get pregnant should get vaccinated in consultation with the doctor. But recent data is suggesting that pregnant women tend to get severely ill with this variant of COVID-19. And when we have the hospitals here a couple of weeks back, if you remember correctly, they were mentioning the fact that they have seen an increase of the number of pregnant women in their hospitals. Our incidence rate for 7 days is for 100,000 is up to 605 cases per 100,000. Another data that I wanted to mention to you is that yesterday 1,284 cases were reported to the Department of Health, and the groups with the highest numbers were 15 to 14 with 153 cases, and that is 12% of all cases reported yesterday. 15 to 24 has 16% of all cases with 211. 25 to 34, 18% of all cases with 227. And 35 to 44 with the highest percentage at 255 cases. I also would like to mention to you, and let me explain this one a little bit. Now, every time that you always ask how many of the people that got infected were unvaccinated. That's a question that we get a lot from you. So when we offered that data, we got some complaints from the public that the data was not actually accurate because they knew someone, all that type. So we decided to delay the data, so we are going to offer you that data 2 days back. meaning we are giving enough time for new data to be entering vaccinations so that when you run these numbers, they are as accurate as possible. So for the day of August 9th, which we have 1,021 cases, 98% of the cases were unvaccinated, 21 cases were breakthrough cases for 2% of all cases that day. Another thing that I want to explain to you, and this is going to take a little bit of time and attention. So I'm going to give you, remember that we mentioned to you that in the vaccination numbers, we may see an increase when we have future access to more data. And we are gaining some access to other data, and the jump has been significant. So I wanted to explain to you what happened before I give you the data. But first, the data that I'm going to offer to you does not alter our percentage in our county. What we've been able to see now is anyone from outside our county that has been provided vaccination by any provider, private provider outside our network. I don't know if that came clearly. I will answer any questions. So for that, the total number of vaccines doses administered in our county jumped today after this analysis to 2,738,249. So for our residents, the number continued to be the same. So we have given to our residents 1,526,666 doses. Now, what changed is for non-residents. For non-residents, remember that we originally were reporting close to 90,000 total doses. So for non-residents, our county has provided 1,134,320 doses. Now, again, this does not change our percentages of coverage, but I think it's important to disclose this information because it also illustrates the role that our county and structures play in a regional market and how we provide services to surrounding counties or even people from outside the state. Now, also we know, and this is a number that we have been chasing and you have heard before, that are 86,194 doses that we cannot assign. And in those, that could change our percentages because 77,263 were doses offered by the VA hospital in Lake Nona. Now, many of those, we are safe to assume that are residents, but we don't know that. And we also know that we have estimated the number of international people that have received doses in our county to be 8,931. Now, for our residents, as I mentioned to you, the percentage have not changed much. I mean, they are going up little by little. But for at least one dose of the vaccine, and that's the measure that was used by the mayor in his executive order, we have 793,666, and that is 65.14% of our population has at least one dose. With that, also I want to tell you that yesterday was a good day, and we got reported 4,904 doses given in our county yesterday, at least that data that has been entered. And also the good news is that 3,091 of those were first dose. So with that, I will answer any question that you may have. Mayor?
Okay, and today we are joined again by Commissioner Maribel Gomez-Cordero. We have Ms. Ilia Torres, who joined us if we need to do any Spanish translations. I also have Director Danny Banks, our Public Safety Director, who is here if there are any questions around the tropical storm preparation. We have Mr. Ed Torres, our Utilities Director, if there are any questions regarding some of the analysis we're doing through our wastewater treatment facilities. And we have Mr. Scott Howard. I saw him earlier from the school district, Maybe he stepped out momentarily. But with that, we'll open it up to any questions at this time.
Steve Hudak from the Orlando Sentinel. Let me direct this to Dr. Pino. I thought I heard you say 17 deaths, 7 vaccinated. What more can you tell us about those cases that will help people understand how a vaccinated person is dying of this disease?
So a vaccinated person who has pre-existing conditions, and we have mentioned that before here, should be extremely careful with this variant. Also, and I don't know specifically the age of those 7, so I'm going to speculate here because you asked a very particular question. But the older you get, the more difficult it is for your immune system to defend and to create immunity. And that's why you have seen other countries like Israel moving quickly into giving a 3rd dose to people who are 65 years or older, because our immune system doesn't respond the same way when we get older. So with that, it's critically important to protect our seniors, even when they are vaccinated, especially if you are in a multi-family, multi-generational home, it becomes very critical. Now, with regard to assisted living facility, we have insisted that the employees of these assisted living facilities should get vaccinated, actually must get vaccinated, because it's part of the protection for the residents of those facilities.
This question is for Dr. Pino. This is Nikki Zizaza with News 6. Dr. Pino, as it relates to the waning immunity, there's been discussion about requiring a booster shot. And, as you mentioned, with, some of these people who are vaccinated who are still passing from it, is it time for that to kind of be implemented, seeing that seniors were vaccinated first? So 6 months out, that could be.
It is my understanding that they are going to do some release of a strategy either today or tomorrow with regard to 3rd dose for special groups, especially people who are immunosuppressed, people who are experiencing chemotherapy, or people that have some specific disorders. I believe that at some point we will be on the 3rd dose, but for the general public has less significance than for those individuals that we have mentioned and you mentioned that could be at a higher risk.
This is Kelsey Thord with West 2 News. My question's also for Dr. Pino. Dr. Pino, you went through a bunch of statistics as you have been throughout this, which is much appreciated. But can you just give me a little bit of perspective on how bad things are right now compared to where we were a couple weeks ago, compared to where we were in January? Just to kind of, I think people are looking at the map, they're seeing all these cases, but coming to terms with exactly how bad things are right now. What can you say to that?
So there are some differences, and it's very difficult to compare because in the previous wave that we were at this point, we had just started vaccinating. So the difference right now is that we have a high percentage of the population vaccinated, and that has an impact. Of course, the Delta variant changed everything, but how bad it depends how you look. The number of cases, we are having more cases in some days than we ever had before. But because we have seniors vaccinated, assisted living facilities vaccinated, so the death rate is not as high as it was. So in that sense, the pandemic is a little bit different. Part of the difference too is that, as I mentioned before, it seems that it's some affinity for pregnant women and developing illnesses and severe illnesses. That's a little bit different. Other places have reported that has seen an increase of younger population getting hospitalized. That may be a little bit different than the pandemic was before. So it's very difficult to compare, but it depends on where you compare. We could be in a better place or in a worse place than we were back in April.
This is Sharon Stone with News 13. This is either for the mayor or perhaps a school district. You mentioned that county-run athletics practices, games are suspended until further notice. Is there any talk of that happening within the school system with the younger kids who are not eligible to be vaccinated?
Scott Howard up.
So the athletics that are taking place right now are the those athletes are eligible to be vaccinated. So you're 12 and up, so high school football, for example, or girls volleyball. What we're doing is just following it very closely, obviously. We're working closely with Dr. Pino and his staff, watching for cases, confirmed cases, making sure that, again, emphasizing if athletes don't feel well, don't come to practice, don't come to school, stay home, and then get a test if you think that there's a possibility, so we can work through that process. So we're doing that right now. We've seen evidence of that as we've dealt with a couple of football programs who've either stopped practicing or have had to cancel or move games. And so they've done some of that now, and they'll continue to do that. We'll continue to work through that process. It's the same process as we used last year. As far as our communication, a little bit different when it comes to quarantines and isolations based on the changes that occurred last Friday. So we're working through some of that as well with Dr. Pino. So thank you. Thank you, Mayor.
Yeah, on that, if I can expand a little bit more to clarify to the public and everyone is that the emergency ruling that we received on Friday only applies to students K to 12 in public schools while they are in school. Meaning, you could be someone who is sent back to school that is in a quarantine, but when you go back home, your quarantine continues. Meaning your quarantine continues to be 14 days when you go back into the community. I know that can be a little bit confusing, and we will progressively instill this in all the documents that we are going to provide the public with. But this ruling only applies to K to 12 students in public schools. It doesn't apply to the teachers. It doesn't apply to anyone else in the community. It doesn't apply to the students when they are back in the community. And the idea is to, in a protective environment, provide students with the ability to go to school back to school as quickly as possible. Now, also, in that order, some of the questions that we have received, and Scott mentioned that, is that on Friday, everything changed because the emergency ruling came into effect immediately. And that's why you have seen so many kids returning to school that were previously placed on quarantine, because prior to Friday, they have to stay home out of school for 2 weeks. Now they can go back in 4 days with a test, otherwise as explained in the emergency ruling. So that emergency ruling is important to have it in front of you, and we will continue to provide that information, and we will be patient and change progressively into new setting.
Good afternoon, Dr. Pino and also Mayor Demings. Following up on that, we interviewed Maria Roach with the Black News Channel. We interviewed a pastor in Pine Hills who had a student test positive and learned that it was contracted from the football coach. What is the threshold in making determinations in terms of athletics? When do you decide that we need to make some dramatic changes? And give us a little more what that will look like.
I think that's a question for the schools. We do not make any decision on programs or closing or anything related to that. All that we do is to advise and provide information and place individuals in quarantine or isolation depending on the level of contacts that you have. And on your question, also to parents, when we send a letter of quarantine, if you have any question or isolation, call the health department. We have a call center. We will explain to you. But sometimes you don't even know that your child was exposed. Because a lot of times we will hear from a parent, my child has not been anywhere, my child was not exposed. But if we are making that consideration and decision, it's because we have the information that otherwise the child has been exposed. But if you have sufficient information that we can corroborate, we are more willing to engage because errors do happen. Scott, do you want to answer about sports? Because
Sorry. Just to follow up on that, our communication, for example, if we know that there's a positive case, whether it's in a classroom or with an athletic team, or if it's with a club, we're going to notify everybody associated with that classroom or that club or that team first and let them know that they're a potential close contact. And then we're going to notify the whole school. So we do it through our communication process. We use the same process this year as we did last year. Parents can get quite a few calls if they're high school especially. But in that case, we would have notified the football team and then notified then the school that there was a case and that the contact tracing was taking place, and that quarantines would be issued by the Florida Department of Health in Orange County, and they would get a letter, and then we'll let them know at the end when quarantines have been issued for that case have been completed, so that way they know that they're either in or not in that group. So we go through that process. We've been doing it since September of last year, and making sure that we're over communicating that. So.
Okay, this is Melissa Thomas with Florida National News. This question is for Mayor Demings. As it relates to the rental assistance program, what is the latest total that you have in terms of families in Orange County that have been helped by that program?
I'm not sure I have the latest numbers. Jane, do you have? About 1,300 families, about $6 million been approved at this point, but we'll get you the specific numbers. Okay. All right.
Lauren Seabrook, Channel 9. Mayor, my question's for you. I understand you said a second corrections officer has now died from COVID. I wondered if you could expand on if there are others who are sick or who maybe were impacted in any sort of outbreak that would cause two to be now dead in, I guess, less than a month.
Currently, at the Orange County Jail, in terms of staff, the latest numbers that I have is we have about 36 currently, and since the beginning of the pandemic, some 396 staff members were either tested positive or were exposed. So those are the most recent numbers in terms of staff. 36 current, okay. Yes.
Good afternoon. The last question is for Dr. Pino, and it's coming from Telemundo. Emilio Ramos asks Dr. Pino, do you support the governor's idea to bring mobile units with antibody treatments? Will we see those here in Orange County?
Having heard about it, I don't know about it. We'll be responsible to making a statement about that. But I believe if that is the case, that will be from clinical practice, and that's totally different to what we do in public health.
All right. Thank you all for joining us today. This will conclude the press briefing. We hope that you have a safe weekend, and the next press conference is scheduled for Monday at 11 a.m. And again, we're monitoring the tropical storm. And if we need to come back to you with anything, we'll do so. All right, thank you all.